Everybody happy?
Yeah.
I'm with Evelyn again, and we're talking about that material there for just for a few minutes. Cannabis and its use for medical purposes. Now, Deputy Tadier, who's sitting next to you, has asked a question in the States about this very subject, and you had an answer. There is a worked example, there is some, which is in Jersey, and it's quite legally here. What did you discover, Deputy Tadier?
Well, I'm not sure. There's still some questions that need to be answered, really. I was interested in knowing whether or not in Jersey a GP can prescribe cannabis-related drugs, but also whether they can be imported into Jersey, whether they can be sold over the counter here with a GP's prescription to back that up. And the Minister essentially said she needs to take legal advice on that. But of course we have got examples. Here is some of that medication which is being prescribed, and this is an oral administration spray of a cannabis extract which Evelyn uses.
And you had it in different forms, Evelyn?
I have, yes. I had the Nabalone, which is a capsule, but that was back in 2003, I believe, but it wasn't getting absorbed. So I was advised by my consultant at the John Radcliffe, Dr. Travers, to open the capsule and dissolve it in my saliva, and then just rinse my mouth with a bit of water. When Dr. Ning at the hospital here, the consultant, found out, he stopped bringing it into the island for me because he said I was abusing my medication.
Did that medication then have any beneficial result for you? Was it useful?
Not really, no, because I didn't get the full benefit from it because it wasn't getting absorbed.
But that one there is more useful.
The Sativex is good for the spasms in the gut,
right.
But I don't get an appetite from it. I don't feel hungry, and it doesn't slow down my bowel.
To give you the best effect, what sort of cannabis product would you need to take?
The strain Sativex plant, and I believe it's pollen. But some people that I've spoken to have said there's different strains. There's indica, there's Sativex, and there's so many, and they all work for different things.
And how would you take that? In what form would you want to use that?
If I could get it, ideally I'd like to be able to have either have my medication brought in to the island, or be allowed to have a plant that I could just smoke the natural leaf without the tobacco.
The actual plant, the sort of stuff that everybody screams about, the illegal stuff, that is beneficial to you, is it? That works for you.
Yeah.
And it gives you appetite.
I get hungry, it stimulates my appetite, it slows down my bowel, so I'm holding on to my food when I have eaten for longer, so I get more nutrients and vitamins out of it. And it helps ease the pain. It doesn't take it away completely, but it does help ease it, which makes it more manageable. It's
fairly simple, isn't it, Deputy Tadier? I mean, the results from one dose, one tablet, one sprig of this magic flower, which there's no other medications that can do this for you. There's no other medications that give you the appetite, suppress the pain.
No. I've tried everything over the years. 17 years I've been doing this, and I mean, I was 7 months pregnant for Brandon when I first got ill, and from there it's just been a roller coaster.
What do you think is the problem with the Minister? I know she's totally opposed to the idea of cannabis being used, but somebody who's in the health business is what she's the President for, or the Minister for Health. You'd think, and bear in mind all the other tablets and medications which are prescribed, all the other treatments, you'd think one more type of treatment would be welcomed, wouldn't it?
I think clearly because there's some baggage that is perceived to go with this, and on one level you're absolutely right. It should be very simple that if a GP thinks that a cannabis-based drug is the correct one for any particular condition to alleviate the symptoms, or even to help, with the condition in general, it should be up to that GP to be able to prescribe that, and there shouldn't be any bars on that prescription. Now the law, as far as I understand, does give permission to the Minister to issue a licence for importation, the cultivation, the selling, etc. of these products if she wants to. So as far as I'm concerned, there's no legal reason that she couldn't do that. She seems to be reluctant, or at least hesitant to do this, I suspect, because there is a wider context to the argument about the decriminalisation and the legalisation of cannabis anyway.
Well, we're constantly told by this medication you've got here, it was quite an expensive, that was £300, wasn't it?
£360.
Which you had to pay for.
Yeah.
Now, again, even though a local doctor actually issued a prescription, quite legally, and it was brought in for you and it was dispensed through a local chemist, you had to pay for it.
I did, yeah. The first one was £257.60, and then it's £102.82 for the courier, so for customs, to clear it. And that one was in 2009, and then this one was in 2011, private prescription again, and that one was £354.
But these prescriptions are through, so it's quite clear the system has done it, and there must be other people who have had the same. Do you know anybody else?
There was one other lady on the Sativex in Jersey, but she doesn't have it anymore because she couldn't afford it, and she was another patient at Dr. Bailey's as well. It was myself and
there's
her.
lots of empty greenhouses over here, Deputy. I mean, you can see that they could certainly save themselves a lot of money, maybe even make some money if they were to grow it for even local consumption, wouldn't they?
It would give a whole new meaning to the word greenhouse, wouldn't it?
It certainly would.
But I think this is completely unacceptable for Evelyn to have to fork out over £300 for prescriptions to be brought in on an ad hoc basis when it's of clear medical use for her. That's not a sustainable or useful way for Evelyn or anyone in this kind of situation. So the law and the health minister in particular does need to give clarity on this issue, and I think really the first step is to simply allow GPs to issue prescriptions.
Have you had any feedback at all from doctors since you raised your question? Has anybody been phoning up and saying, look, I want to be able to prescribe this?
I've not any direct feedback from GPs, although I hope that maybe the publicity surrounding this will lead them to get in contact. But certainly there's been widening discussions in social media about this.
You've presumably you were first introduced to, I don't know where, in the UK you go to Oxford for treatment. Do they prescribe it there in the Oxford hospital for their patients?
No, they don't prescribe it. Well, I mean, there's people that are doing trials on the Sativex at the moment, but they don't prescribe that you can go out and have a joint. The doctors know what I do, and I do tell them that I'm going outside.
Of course, it's a bit ironic really, because you smoke it in a cigarette form or something like that, you turn it into smoke, which of course smoking as such as anywhere in the hospital is prevented. Could you take cannabis in any other form, cakes or people eat it, would it work? Is it the smoke that gets absorbed into your system? Is that the technique you need?
It is, yeah, because if I've got a joint, I'll smoke it, but even if I get 3 or 4 puffs off of a joint, as soon as I feel I'm hungry, then I'll eat, and it can take me an hour and a half, maybe 2 hours to eat the meal, and that's on one joint, but at least I'm getting the food into
What next for you, Deputy? You've got to wait for the answers to come back from the Health Minister and the advice from the Attorney General. Sometimes we're not allowed to know the advice of the Attorney General if it's given to an department.
I think, well, in one sense, like, I could have asked the question of the Attorney General to do with, what's the law surrounding issuing of licences, and the law's there. I mean, it's written down. Of course, it's subject to interpretation. So I'll clearly be following this. But it's evident. I mean, each case is different, and that's what's interesting about Evelyn. So because she'll absorb the product in a completely different way because of her condition, there are others who could take, oral forms, and that would be fine for absorption. In Evelyn's case, that's clearly not the case. It's not even a one size fits all.
We'll stop there, but there's some other aspects of Evelyn which we might want to discuss a bit later. Thanks very much indeed.